Taiwan's Health Ministry's Health Promotion Administration, the HPA, announced recently that it will lower the age threshold for free annual health checkups to 30 years old starting this month. This change comes as a part of an effort to reduce the incidence of chronic diseases through early detection of major risk factors. Taiwan has been promoting preventative healthcare since 1995, initially offering free health checkups every 3 years for individuals aged 40 to 65, and annually for those aged 65 and up. However, with rising prevalence of risk factors such as high blood pressure, high blood sugar, and high blood lipids among younger populations, the HPA is now extending the service to include people aged 30 to 39, with checkups available every 5 years. Health Minister Chou Taiyuan emphasized that these checkups have played a crucial role in protecting the Taiwanese population from chronic diseases. He also noted that by expanding the age bracket and detecting early warning signs, the initiative is expected to improve public health outcomes. Today, we'll talk about whether you should be one of the 3.2 million people who can benefit from this expanded program. I'm your host, Joey Chou, and this is Beyond the Reefs. Hi, you're listening to Beyond the Reefs, a show produced by Radio Taiwan International. Here we talk about socio-economic issues that are faced by Taiwan and their broader impact around the world, beyond the reefs of this island nation.
President Lai Ching-te aims to increase Taiwan's average lifespan by 3 years. The goal is part of a new long-term care plan for the country. Health officials hope to meet the needs of an aging society with a long-term care plan to improve elderly health care and welfare. Taiwan is set to become a super-aged society by next year, when nearly a fifth of its population will be at least 65 years old.
Our guest today is Julia Bergstrom, senior editor at Taiwan's Business Topics magazine. Lately, she's interviewed a lot of medical experts and written quite a few articles on cardiovascular diseases and how the advancement in AI can help. My first question for Julia is, to introduce herself and why has she been writing so many articles on health?
Right. I'm Julia Bergstrom. I'm the senior editor of Taiwan Business Topics, a publication by the American Chamber of Commerce in Taiwan. I write so much about healthcare because it's a core issue for us. And I think also just the personal interest, the older you get, the more important you realize how the older you get, the more you realize how important health is, right? But also with an aging population, considering the fact that Taiwan is becoming a super aged society this year, I think health is becoming a core issue for Taiwan, not only in terms of the well-being of citizens, but also production and the economy.
Yeah. In fact, thanks for reminding me that it's 2025, isn't it? So more than 1/5 of the population is now over the age of 65. And yes, you're right. It is a core topic for us to explore. However, I wonder, you guys do this business climate survey every year. Has that problem surfaced on your climate survey?
Definitely. So our 2025 Business Climate Survey is about to be published.
Okay.
And I can tell you right now that aging population is one of the top requested areas of focus for the government from industry. It's a core issue for industry, and not only in terms of caring for health, but also when it comes to working population. Job market is getting quite saturated. And while companies are still overall satisfied with their ability to find talent, the pool is shrinking.
Okay, I can definitely see that. That's an issue that most of us can wrap our heads around. But I'm also wondering, are there a lot of expat business people who tend to have a long stay here in Taiwan, and then they're starting to age, so they're looking for welfare benefits that could better suit them? Is that also one side of the function?
I do think that there are a lot of people here that are settling in and are beginning to age. our members are usually pretty well off, but maybe they are realizing themselves the importance of having robust structures that the health of people. And of course, they also want access to the newest and most advanced treatments as well.
Yeah. Okay. So let's talk about that. In your article, you highlighted that cardiovascular disease is the second leading cause of death in Taiwan, the first being cancer. My dad has cancer, by the way, and I hear stories that are gut-wrenching from him. It's basically you have to be of a certain financial standing to stay alive because there are treatments or medicine that doesn't come into Taiwan that's affordable. I don't know if you want to talk about that, but I'll continue to ask my question mainly based on cardiovascular diseases. Are there signs as to how this issue has become overwhelming, particularly here in Taiwan and maybe in Asia as well?
Well, we already talked a little bit about the aging population. So with the super age society in which 20% are 65 or above, you also get a higher prevalence of conditions like hypertension or high blood pressure and heart disease. So both cancer and heart disease or cardiovascular disease are issues that become more prevalent with age. That's one factor. And of course, in Taiwan and Asia, the traditional diets, which are really rich in vegetables and grains and seafood as well, especially in Taiwan, they are being more and more replaced by diets that are high in processed foods, saturated fats, and that contributes, to obesity and diabetes and also high cholesterol. And those are all risk factors as well. And then, of course, you have the high pressure, stressful lifestyle that comes with modern society, but especially in Taipei. I think we all know that the Taiwanese work culture is quite high stress, high pace, high pressure, and that also leads to risk factors for cardiovascular disease. When it comes to cancer or cardiovascular disease, the most advanced treatments in Taiwan are saved for those that are in the most advanced stages. And so that comes with higher costs because people are waiting to become ill enough to get that treatment. And in the meantime, for cardiovascular disease, they often develop kidney issues as well. So now you have to treat a second condition. So that's a huge issue.
Interesting. So based on your research, the same goes for cardiovascular diseases, as in the national health insurance may not insure certain level of severity. Is that the same for cardiovascular disease?
So for cardiovascular disease, the more advanced treatments or surgeries are not covered until you're at a very late stage or at high risk. A life-saving surgery that you could have in the early stages of your disease, you won't get covered for. So your disease will progress, and in the end, you might get that surgery, but at what cost?
Yeah, and is it reversible at that point? So now that we're talking about certain procedures or surgeries being covered or not by the insurance, let's talk about the economic impact. So how do cardiovascular diseases affect, obviously, just not just the individual patients, not just the family, but a broader societal and economic impact in our health care system?
So, the broader societal costs are quite high because of the fact that people are in quite late stages. And if we just start from the fact that cardiovascular disease mostly affects senior citizens, and in Taiwan, healthier seniors play a really pivotal role in supporting the family structure, especially raising their grandchildren and helping working parents. So when they cannot do that because of cardiovascular diseases or cancer or other diseases, it often forces other family members. And of course, we still live in a society where that is typically the woman to step in to those caregiver roles, and that can disrupt employment, educational opportunities, but also family dynamics overall. So that's one part of it. And then, of course, for the National Health Insurance Administration, they're on a very restricted budget, and so they have to prioritize, of course, those in the later stages and at higher risk. But because of this, early prevention or early detection is not prioritized, and those more complicated diseases or high risk stages are more costly. So in the end, you're spending more money than you would have if you would have invested in prevention and early detection.
Yeah. A lot of that money, of course, comes from the NHI, and as you mentioned, the budgetary concern is pretty alarming because just this year, they made some pivotal adjustments. For example, if you've traveled overseas for more than 6 months, you're no longer fully insured, which I think is a very sensible adjustment.
Yeah.
But yeah, the family factor I did not consider. Very glad that you pointed it out. You're right. It tends to be that, especially with the high cost, be it real estate or just consumer price index is rising. If you want to buy a house, if you really want to buy anything these days, you're relying on your parents. And so if they're no longer healthy, that is a big financial burden to the whole family. So what are the most significant barriers preventing effective prevention or diagnosis for cardiovascular, or just what seems to be the reason why people, aside from receiving treatment, because you say sometimes you have to be late stage to receive certain type of insurance coverage, but why are these things not preventable, and are there better ways to prevent them in Taiwan?
So, apart from the financial constraints of the healthcare system, I would say there is also a general lack of awareness regarding the importance of early detection and ongoing treatment of risk factors of cardiovascular disease. So, for example, a lot of people might get diagnosed with hyperlipidemia, which is a common problem with fats that build up in your arteries, but they might not take it so seriously. They know, oh, I have fatty arteries, but life is stressful and that's a tomorrow problem, and they don't take it seriously, and then it develops into something that's actually serious. So public awareness is a huge part of it. Another part is, patient advocacy. So, for example, one very simple way of discovering a lot of heart issues is by listening with a stethoscope for heart murmurs. And that takes maybe 2 minutes, 3 minutes for the doctor to do, but the doctor has a lot of patients to see. So unless you ask for it, he might not do it. So being able to advocate for yourself and ask for certain small steps that can help you detect issues early, those are concrete steps that can be taken to improve the situation as well.
I don't know if you're aware of the situation in other parts of Asia, but let's say if you do, then please share what the situations are in there. If not, at least what I do know is you're from Sweden, a country that has the tradition of family doctors. Do you think that this is something that could be better addressed with maybe family doctors?
From my own perspective, I really wish Taiwan had a family doctor, because when I was living in Sweden, it was very easy for my family doctor to see what are the past issues that you've had. Okay, have you been here before for this issue? And they know me. And so kind of discovering things was a lot easier, I would say. So my point of view is that would be great if something like that was possible. I'm not sure if, the Taiwanese healthcare structure allows for it, though. Sweden has universal healthcare, whereas Taiwan has a single payer system. So it comes from the government, but you have private hospitals and public hospitals. So I don't know how that would work in Taiwan's case.
Yeah, that would be interesting to see them trying to implement it, because after all, just by the sheer behavioral traffic of people that comes in and out of these clinics and hospitals, I wonder if we have enough doctors to use the family doctor process. What about other parts of Asia? Do you have friends who maybe have cardiovascular diseases? What are the experiences in other parts of the world? Have you heard?
I actually haven't heard much about that, but I do know that Taiwan likes to benchmark itself against South Korea and Japan, and usually South Korea and Japan perform better. I know for cancer, they definitely do. So apart from spending more on healthcare compared to their GDP, South Korea also has, if we're focusing on cardiovascular disease, their national health insurance service offers subsidized screenings for, hypertension, diabetes, hyperlipidemia, and all these risk factors. This is something that Taiwan hopefully will be doing soon, because Taiwan's NHIA launched the 888 plan. So they target what they call the three highs. So high blood pressure or hypertension, uh, hyperglycemia, and hyperlipidemia. So they want to get in 80% of patients suffering from these conditions into the caretaking network within the next 8 years. So hopefully there will also be subsidized screenings for hypertension, high blood sugar, and high cholesterol as well. South Korea has also invested really heavily in AI-powered diagnostic tools for cardiovascular diseases. And Taiwan has adopted AI in some healthcare areas, but applications in cardiovascular risk are still in much earlier stages. And then South Korea's public health initiatives also include a lot of community-based interventions. So they have local centers that provide education on diet, exercise, and hypertension management. And again, this is what we discussed earlier, that patient education, but also advocacy is really an important factor of it all.
Yeah. And the thing is, on paper, it sounds like that's just another couple of items, but these things actually take years to implement. So that's something that Taiwan needs to work on now.
Yes.
A final question is that you wrote another article on advanced robotics surgeries in Taiwan.
Yes.
And this may be the final treatment that a lot of people with cardiovascular diseases face.
Mm-hmm.
So is this field likely to contribute positively to the plight of cardiovascular patients?
So I'm a huge fan of robotic assisted surgery because my mom actually has cancer, and she benefited from robotic assisted surgery, and I could see with my own eyes just how much faster the recovery was and how much easier it was to recover from such a surgery. So the benefits of robot assisted surgery is that because they use such small incisions, the recovery is so much faster. And also they have a lot of tools that prevent human error. So you still have a person controlling the robotic arms, but there are a lot of helpful tools that prevent some of the errors that might occur otherwise. So in terms of cardiac surgery, it's used for minimally invasive procedures, cardiac tumor excisions, or small valve repairs, or something called the coronary artery bypass grafting.
Fancy
So
words,
when you get in there with when you do smaller incisions. There are also some emerging applications. So robotic platforms are being explored for some more complex procedures. One of them is transcatheter aortic valve implantation, also known as TAVI. So this is where you replace one of the heart valves. And it's very interesting. In my article, I interviewed a company that does this, and they actually get it in from the calf, the new heart valve, and then all the way up to the heart. Is very impressive. But with robotic surgery, this could be an easier operation to do.
Yeah, now that you mentioned, I do remember that my dad had cardiac surgery and also cancer surgery. So he did highly depended on using the Da Vinci system, right? Or I think that's what it's called.
Yes. The Da Vinci systems are about 80% of the market. So those are the most common ones. Yeah.
So since we started our conversation talking about the economic impacts, are they cheaper, or can they be made cheaper anytime soon?
They are still a bit more expensive, but then when you look at other factors, so if you don't just take the actual surgery into consideration, you take the number of days a patient stays at the hospital, that's a major cost. Or, if you have to have a secondary surgery to fix some issues that arose, then they are actually quite cost effective. And the NHI and system in Taiwan is now reimbursing a lot more procedures using robotic assisted surgery. I think they added less than 100, but nearly 100 new applications this last year. So they are really seeing the patient benefit and the economic benefit of these systems.
Okay. And as technology excels so quickly these days, I'm pretty sure that soon we'll be having another conversation about this to see what Taiwan has done, possibly implementing AI into the latest, robotic assisted surgery. So Julia, thank you so much for your time. I appreciate it.
Thank you.
I have been Joey Chou, and this is Beyond the Reefs on Radio Taiwan International.